I'm delighted to be joined today by Councilman Curren Price from District 9, as well as Dr. Douglas Harrington from GUARDaHEART. There's a really exceptional event that's going to be taking place in District 9. What's going on down there?
Well, we're going to be providing antibody testing for those who are interested and who are concerned. We know how important testing is. We've done it extensively in CD9, and so we're very excited to have Dr. Harrington and his team come to our community to provide this much needed test.
What exactly is this? Because it's an antibody test versus the swab test that tests for active virus.
The test that we're offering at this particular thing is an antibody test. And the reason the antibody test is important is because you're probably more familiar with what's called a swab test. The swab test is detecting genetic material from the virus, and it's only for people who have symptoms. The antibody test, on the other hand, is for people who do not have symptoms or who had symptoms in the past and want to know whether they actually had COVID. And so it allows us to do two things. Number one, we can tell you whether what you thought you had in the past was actually a COVID infection. Number two, it will tell you whether or not you've developed a level of immunity to the virus. And the reason that's important is because people who do have antibodies have less virus in their body than people who don't have antibodies, so they're less likely to infect somebody else. There's a third benefit. There are people who are deathly ill in the hospital, and there is some evidence that taking serum donations from patients who have recovered from the virus who have antibodies can be used to treat those people. So you could potentially be a donor for somebody that's severely ill, so that's an added benefit.
Is there a cost to this?
There's no cost. We want to make this available to individuals at no charge. It's very, very important and very critical. Just as there's been no charge for the COVID-19 testing, there'll be no charge for this antibody testing as well.
It's intended to encourage all of you to come and get tested. So what it does for our public health is that the swab test was predominantly testing people with symptoms. And it turns out that people with symptoms are a smaller segment of the people who actually got infected. And so what this does is it gives us a better idea of what the true prevalence of the disease is in the community. In July and August, we had a lot of what we call the millennials out there doing parties and things during summer break. And very few of them actually got sick, but they spread the infection through all of their friends and themselves, and they brought it home and transmitted it to older people. So it's really important that you know what your status is, and the public health authorities can then get a better idea of what the prevalence of disease is in that community, and they can intervene.
The testing will be at our district office on 43rd and Central. Individuals are encouraged to sign up in advance, and they may do so at GUARDaHEART.org, or they may call 866-299-8998.